Singapore will give COVID-19 booster shots to seniors and immunocompromised people as it prepares to live with the virus normally. The Pandemic Task Force says that the first batch of people 60 and above will get their third doses of mRNA vaccines from this month. Most would have gotten their second doses in March or between 6 and 9 months ago.
The reason why we are prioritizing those above 60 is because we know that if they do get infected, they have a worse outcome compared to those that are younger. The increased risk of getting admitted to hospital, increased risk of needing oxygen supplementation, and increased risk of getting into ICU, and correspondingly even an increased risk of death. So we have an interest in making sure that we protect them even further to reduce this risk of having a bad outcome.
At the same time, Singapore is stepping up testing in the community. The public will be able to pay for fast and easy tests at 20 quick test centres. That's from next month. Authorities will study whether more sites can be set up across the island. Workplace guidelines for more frequent antigen rapid tests are also being discussed. These measures come as the task force says that the country remains committed to reopening plans. It won't make any further moves to tighten nor relax measures, even as cases continue to go up. Tan Se-hui with this report.
Most of these cases right now are from clusters at bus interchanges. There are more than 300 linked to these places. After testing 7,000 staff, about 2% of those tested positive. But the task force says most of them are young, mostly vaccinated, and 98% show mild or no symptoms. There is also no evidence that any passengers or people using public transport are being exposed and infected. This cluster is also different from the previous Jurong Fishery Port cluster because now more people are vaccinated. The task force says it will take the rest of the week for the situation to stabilize and numbers should come down in the following week. They added that they won't be making any further changes to measures now to take time to monitor the situation and ensure it does not lead to severe illnesses or those that require intensive care.
We have just in recent weeks launched a few pilots where we're talking about vaccinated travel lanes with Germany and Brunei. We're talking about allowing our dorm workers to be out in the community more. So quite a number of things are happening now, and we want to allow these pilots to continue over the next few days and weeks. So the commitment to reopen continues. But as we have always said, we are doing it in a controlled manner.
The task force says when the virus is endemic, the strategy will no longer be to eliminate or isolate the source. So unlinked cases won't be as important in the bigger scheme of things. But what authorities will keep a lookout for is whether unlinked cases are due to new viral variants and whether it means more people end up in the ICU. Besides, more than 80% of the population is already vaccinated.
We are now in a very different stage of our battle against COVID-19. In the past, we tried to suppress every cluster, trace down to the last infection, and try to eliminate them. But with the more transmissible Delta variant, this will be very challenging to do, and we may not be prepared to pay the price of doing so in the form of border closures, circuit breaker, heightened alert. It is just not sustainable. Therefore, with a high vaccination rate that we have now, we choose to live with COVID-19, transit to a COVID-resilient nation.
So moving forward, daily case numbers won't be the focus. It will shift to those who require supplementary oxygen or ICU care. Information on new clusters will still be given so that the public can take action to avoid these places.